No, if you're already using the Zoom, it's up to you if you still want to use the Zoom on the YouTube or not. But this is going to be live now everywhere. But highly recommended to share the messages on the YouTube rather than on the chat box on the Zoom. Because I'm only going to watch the one chat box in here. So definitely, if someone is using the chat box, share the message. Just give me a second. If someone is using the chat box, highly recommend to ask me questions on the live chat on YouTube. We'll start the session soon. I'm just waiting for a few more students to come over maybe. So let's see here. And everyone, feel free to participate. Ask me the question, doubts, wherever you have, because this is one of the most important topic which I'm bringing out today. I know this topic, like everybody was waiting on this topic also since very long. So definitely, if you have any questions, this is going to be the opportunity for you today, to ask me the doubts and questions if you have. Yeah, so we'll go from there. Now, let me just share the screen with all of you and let me know if you're able to see my presentation, right? If my voice is not audible or breaking sometimes in between, or you're not able to see the presentation, feel free to let me know, right, at the same time, so I can just make the corrections in there. Kiranjit, I think your mic is unmute right now, so maybe just mute yourself, my dear. Just unmute it when you need to ask me any questions. Definitely unmute at the same time, okay? Okay. Thank you so much. And let's see, one more voice is coming now. Someone mic is unmute. Everyone, please mute your mic. Okay, I think it's Kiranjit. Kiranjit, your mic is unmute right now. Can you please mute yourself? Okay, I did it for you. It's done. Okay, no worries. Okay, so without wasting the time, let's get started. I hope you guys can see my screen now. The presentation is visible, but you can always let me know if, as I said, my voice is not audible or you cannot see my presentation, right? So I can fix it on my side. And again, highly recommended before I start the session, just a reminder back again, use the live chat box in the YouTube if you want to type something for me, okay? Because sometimes during the class, I cannot open the Zoom chat box at the same time. So highly recommended to use the YouTube chat box instead of using the Zoom chat box, because sometimes I missed your question maybe, right? So let's get started without wasting the time, everyone. So today's topic, as I said, one of the most important topic is going to be in the whole lectures, whole courses in the NCLEX RN. And even if someone is here preparing for NCLEX PN also, or XPN also, this is also going to helpful for you today. Because in this class, we are going to practice some questions together. Not just the questions, I am actually bringing some tips and tricks and strategies at the same time. So definitely it will be very helpful. So my overall plan for these classes is actually going to be divided into two different lectures, everyone. The one we're going to do it today, the one will be tomorrow. So please join me again tomorrow, but that will be a different time. It will be 10 o'clock in the morning as per the Edmonton City, Alberta. But if you are watching this lecture from any other part of the world, you're not quite sure about your timing as well, I highly recommend it. Either you can just Google it, or if you still have any doubt, you can always drop the question for me into the WhatsApp group, or you can also drop the question for me into the YouTube as well. Okay, so this is going to be divided into two different classes, as I said. So do not forget to watch the second part after this video. So overall idea for the whole 2 different days is I'm going to practice some amount of questions. It depends how much time we have today and tomorrow. Roughly, I'm making an idea for now about 25 questions at least. But if we got some more time tomorrow as well, maybe I'll bring some more questions at the same time on the screen. So it depends how much time we left together. The second thing, definitely, as I said, we are going to do some tips and tricks and strategies because a lot of students around the world, I know they know the content, but the problem is how to apply the content in there into the questions or how to still find out the answer even if you have less knowledge about the content or you don't have a much knowledge about the content. Okay, so this is my goal always in my every single class. If you know me from the very beginning from the CAPS nursing classes. Now, the third thing, as I said, I feel like some of the questions they might require discussion about some topics as well. So some strategy I might need to give you for a particular question behind the scene as well. So I highly recommend it during the class. If you can have a pen, pencil, paper with you, that will be awesome because sometimes the things are not written on the screen, the one I'm going to say it actually. So it's a better to make some notes in there. Now, apart from this, strategies, of course, how to find the right answer. As I said, this is another thing I'm going to discuss in there for sure. Now, let's see this one together by using the first question on the screen we have. So the first question I have here is, a nurse is giving the instructions to the parents of a 6-year-old child who has a head lice. Now, which parent statement shows the teaching was effective, right? So first of all, when you read the question, as I said in my other videos as well, always try to find out the keyword, right, into the question. So the keyword is always hiding before the last line of the question, before the last line. So if this is going to be the last line for you, like which parent statement, so before the last line, you always have a keyword hiding somewhere until it's making sense to you. But if it's not making sense to you, you can go back a little bit more back into the question. Here, I can already see the question is about the head lice. So this is my keyword already, right? And after you knowing the keyword, you should know what is the last line is about. Because if the last line looking for wrong statement, you look for wrong statement. If they're looking for right statement, you look for right statement. If they're looking for first priority initial, you find the answer based upon that, right? So here I want to see the right statement. And that's how you should know the teaching was effective, right? Now, how do we know this? Let's say you do not read the topic about the headlines, but you know what is the headlines basically it is, but you still don't know the content maybe behind in there a lot as per your NCLEX exam. So how you can handle this type of question? So the first one we have is I need to get rid of all my child stuffed toys that cannot be washed. So simply ask yourself, you put yourself into this situation and ask yourself, if you are a parent here of a child, of a 6-year-old child who have this problem, do you think you will get rid of all the toys in there or you will only get rid of those toys whichever required and you think those toys can easily catch the lice in there? So you ask yourself again in the form of good idea, bad idea, or either you can ask yourself, is it a great idea like all the toys or only some of the toys which is required to be thrown in that area for the like something which cannot be washed, right? So ask yourself into that situation. Now, everyone, let's participate in here. As I always say to my students, please remember this is not just a recording class. I really want you to unmute your mic all the time. Come forward and try to participate with me always in the class. Tell me if you want to keep this answer in, you want to take it out, you think it's a good answer, bad answer. What do you think about
Man,
this?
it's bad answer.
Bad answer.
It's a
Bad
bad
answer?
idea.
Bad answer. Yeah.
Okay, why is this bad? Anyone?
Maybe because
Because
it is not possible that if any parent read all of their child stuff toys and they cannot wash it. This is not
Very
possible.
Very good. And also, not even financially, it's possible as well, right? So, always put yourself in that situation. Definitely, you will find out the answer, as I said, right? So, definitely, if I'm a parent of this kind of child, I'm not going to rid of my all the toys in there. I will still keep those ones which can be washed easily and only throw out that one which I think they cannot be washed at all, right? So due to infection control purposes, this is what I will do in there. Only throw that one what I feel like that cannot be washed at all for sure. So definitely this is a bad idea. So if this is a wrong statement, it is a bad idea. This means teaching was not effective. So I'm not going to pick this one as my right answer in here. Now you go to second option. I will wash my child clothes Let's say if you are the parent, are you going to wash the child clothes? Yes. You're going to wash the child bedding? Yes. Towels? Yes. In hot water? Yeah, great idea. Why not? Then if not the hot water, are you going to then wash them into the cold water? Cold water is a bad idea too,
Mm.
right? So that means hot water is a good idea if you're washing all these clothes into there, right? So what everyone think on this? Do you think it's a good idea? You want to keep it in or you want to
Good
take it
idea.
out?
Yes, ma'am.
Good
Good
Good.
idea,
idea.
man.
Okay,
Good
very
idea.
good. I can only hear two, three voices so far. Everyone, please try your best to participate because remember, if you're not participating, you're not learning much. Okay, if you're only listening me, you're just listening me. You will get benefit only 90%. But if you try to participate, clear your doubts at the same time as well, because this is the only classes conducting for you specially, right? Come forward and ask your questions and doubts with me so you can master all these things with me together. So definitely this is a good idea. I'll keep it in, right? Now the third one says I should put my child eating utensils through the dishwasher. Excuse me. I should put my child's eating utensils through the dishwasher. Do you think it's a great idea or do you think we should wash them like into the washing using my hands or something? Like, which one is the better? Because they are talking about the dishwasher in here.
Ma'am,
Number
use
two is
this
better.
idea.
We can use
Great idea.
via hands also.
Yeah, very good. So still the second is a better answer rather than number
Yeah.
three, I would say, right?
Yeah.
Now let's talk about the number four. I should arrange for our home to be treated with insecticide. Do you think this is practically a great answer? It's a possible a lot, and that's a solution to the problem of the head lice. Do you guys agree with that? That it will stop coming back even after you treat with it? Or do you think the second one is still sound the better answer?
Second one is good one.
Second
Second
one
one.
for Rajan. Okay. What about the other students?
Second one is better.
Second one is still better.
Second one.
Anyone?
Yeah,
Yeah.
second one is better.
Second is still better.
Comparatively,
Okay,
Yeah.
perfect.
yeah.
Let's log the answer then, everyone. So the right answer for this question is number two, not any one, three, and four. But you can always stop me in between if you still have any doubt, any question for me. In the meantime, I'll move on to the next question. Now, for the next question, before I read this question also, I want to tell you guys some strategy actually for this question. If you can write down, make some notes, that will be great, right? Because this is something my own creating strategies to find out the right answer for these type of questions. Now, the question is actually around, like basically in what situation you go to charge nurse, in what situation you basically go and confront your colleague, in what situation, right? So these type of questions are very common, I would say, not just the NCLEX exam. If anyone writing the Rex PN or CPNRNE, even I have seen some other exams like DHA or any other exams too. These questions are very common, but they're not going to ask you a lot of questions in there. Most probably one or two on an average, but you still need to have a little bit idea, not just for the exam purpose. Even when you pass the exams, when you go on the floor, you should know in what situation you should go for the colleague or in what situation you need to go and report to the charge nurse about it, right? Like what kind of situations happening on the floor. So you need to know that. So before I read this question, as I said, let's write down a strategy on the side for yourself. So on the side, maybe you can make a box, draw a line in between roughly, right? On the left side of the page, you can write it down like in which situation you need to go and confront the colleague first. And on the right side of the screen, you can write it down in which situation you do not talk to the colleague, you just report about the colleague behavior right away and just go to the charge nurse in there, right? So this way you can divide it these two boxes. Now on the left side of the screen, in which situation you go and confront the colleague first, very simple answer. These are those situations which you think you find it number one non-dangerous for the client, for the environment, for the facility. If these are the non-dangerous thing, like this is something you feel like not a it's not like a dangerous thing, that's something happening right away, happening a big thing in the building, but this is something, those things which you can handle by yourself, and it's the client safety is still there, and it's not like a dangerous for the environment too, right? So these are those things. So for example, if I say, let's say if I'm doing a catheter care right now, and one of the student from you being as a nurse on the floor, you watch me, maybe how you doing this procedure, maybe you were walking in the hallway and you notice that I'm not even wearing the sterile gloves or anything in there. I'm just, being in rush, quickly with my procedure, right? So basically, what are you supposed to do in that situation? Do you think you go to charge nurse right away? No, the answer is not.
No.
You definitely enter inside the room, intervene the situation, but you do not say anything, speak up in front of the patient. Instead of that, you try to offer help me at the same time. But after helping and solving that particular procedure, whatever we are performing in there, after that, remember, whenever you confront the colleague, you need to go into the private space, right? Not in the front of the client or the family members. Now, when you go to the private place after that with me, definitely there is the time you're going to confront with me after finishing with the procedure. So definitely confront means it's not like you're going to ask me question why. No, it's not like that. Confront means you will try to ask me, like, okay, do you remember? Let's say, for example, if I say person here, name here, Rajan. So I would say here, Rajan, like, for example, Rajan, do you know, like, I saw you before, you were not wearing the sterile gloves. Do you really know about this procedure or you just forget to wear it? So basically, I will try to explore from her first. And if I feel like she don't have a much knowledge about that procedure, I will recommend her to go and collaborate with the charge nurse so she can get some more education on this topic, right? But if she already know, then I will just simply remind her, okay, Rajan, that's okay, happened this time, but please remember next time we really need to like use the sterile gloves in there because of the definitely the sepsis can be happening there, right? Infection will be there for sure if you do not wear the sterile gloves in there. Anything could be happen to the patient. So I try to explain her in such a way so she don't feel bad, but at the same time I try to confront the situation, right? But remember, if she or he is doing the mistake, same mistake, or it could be a different mistake, but usually a same mistake. If the person is not listening me and the person is still doing the same mistake again and again on the floor, and you notice that now it's the time for you that this thing is becoming dangerous now, which will go to the right side of the screen in this strategy, then you report it to the charge nurse immediately in there, because definitely now your colleague is not listening you to change the behavior. Now you simply report it. Another common examples are like, let's say your colleague is coming late for the work, right? If it's a one time only, just a reminder. It's not about a dangerous something for the client on the floor or the safety related on the floor. But if someone coming late again and again on the shift, definitely the right side of the screen, you're going to put this answer in there. Simply report to the charge nurse, right? Or let's say they give you some examples which is already dangerous in the building. For example, maybe you see someone, she's doing a physical abuse with the client, right? Or a verbal abuse, maybe holding the hand too tight with the patient. This is already too dangerous, right? In that case, you do not need to confront the colleague in that area. You simply go to the charge nurse and report about the situation immediately, right? Without wasting the time too. So what I'm trying to saying in this strategy is it's pretty simple and straightforward. Whenever you read the question, first thing ask yourself, is this something dangerous? If you think it's dangerous about the client or maybe about the safety related environment of the floor, definitely, if it's a concern thing, you need to report the right away as soon as possible to the charge nurse. But if this is something non-dangerous, you think that can wait, you need to report and confront first in that area, right? So this is very important for a lot of nurses to know because common questions come on these things as well. And a lot of time nurses don't know when they read the question, what should I do in that case, right? So for example, this question is, during a shift change, a nurse who is finishing the work and she noticed that the incoming nurse smell of alcohol, right? And is slurring words already there. So if you already smell alcohol, if you already know she's talking with some slurring words as well, now what do you think what should be your action in that area, in that case? The what action should the outgoing nurse needs to take? Again, it's a select all or apply type of question here. Now, here in this question, as I said, only pick that answer which you know. Something you don't know, better not to play, right? So the first one is stop giving the hand of report to the oncoming nurse. Do you think you're gonna stop giving the report right away? Is that something you're supposed to do? If you're not sure, better not to play. But if you're 100% sure, I'm not gonna give the hand report for sure. This is my first answer right away when I smell something, then you only pick up this as a right answer. So what do you guys think on this? You want to keep it in
And
or you want to take it
should be
out?
applied. Should be applied.
Keep it.
It
Okay.
must be applied.
Okay, so a lot of students saying like, okay, let's be apply for this one. Stop giving the handoff report because you don't want to give the handoff report in there. Very good. Okay. Now the second one you have is the write up the incident according to the facility policy. This is something you're supposed to do in that scenario or no?
Yeah, ma'am, this
Yeah.
is extremely
Yes.
Yeah.
important
Very
for
good,
Yes.
your
very good.
conversation.
This is
Yeah.
something incident happened on the floor. You saw something and you already witnessed that situation. You need to report it and you need to write down the incident report as well. Number three, inform the charge nurse right away. Good idea, bad
Yes.
idea?
Yes.
Very
Good
good.
Yes.
idea.
Let's
Yes.
see.
Very
Good
This
good.
is
idea.
something dangerous. Good idea. Let's do that quickly. Say nothing. Are you not going to say anything? Say
We
nothing.
should say something.
We should do
Nothing.
something and say
Yeah.
something in that
Yeah.
area, right? Because it
Ma'am,
says
I
say
do not,
nothing, but keep the eye out for unsafe behavior. Seems
ma'am,
like you're not
Mm,
doing anything
no.
in there. Yeah. So
I,
No.
Sammy
Samula,
has a
No,
question for
it's
me.
bad.
Samula, I do not play with this because I am not sure on that. So therefore, if I sit in exam, so I would not play with this
Very
because
Ma'am,
good.
I'm
we
not sure
But
on that.
let's say, Sammy, if I'm the nurse and I actually drink alcohol today in front of
I
you
will
during
do.
a shift, right?
I will
So
do,
do you
ma'am. I
think
will
you're just
forget.
gonna stay quiet in that area, or you still have to do something and say something in that place?
No,
Because
ma'am.
you're
ma'am,
already
Obviously,
doing a shift report.
I will keep my
Report.
entire focus on the person for his behavior, what he does, what he do. So therefore,
But you
I will
you
pick
gonna
that.
you gonna just stand there quietly because it's during a shift change. That's something you notice. Or you simply gonna do something which stop giving the shift report. Are you gonna say that, okay, I'm not feeling comfortable to give a report to you right now?
ma'am, we cannot ignore. We
Yeah,
need to do something.
No.
We need to do something still.
Yeah.
Very good. So this is
yeah,
what I want to
because
say
it's
in
the
that
end of
area.
Yes.
shift.
Very good. Sammy, I hope you're getting my point. What I'm trying to saying
So,
in here, I want to
what the
make sure you
point?
guys understanding too, right? Now the last one says directly tell the incoming nurse directly that they are not safe to do work on the floor. What do you guys think? Can you say that directly? It's a confront. Can you confront?
No,
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 ma'am.
we can't.
This is something dangerous. Better not to deal with
Yes.
it by
Okay.
yourself, right? So the answer for this question will be 1, 2, and
One,
3. And you only pick that
three.
answer which you know for sure, but something you don't know, better not to play, as I said. But again, if someone has any doubts for me, you can always stop me in between. Moving on to the next question in here. The nurse provide teaching to the parents of a school-age child and diagnosed with the erythema infectiosum. See, I remember this right now. Somebody asked me a few days ago in the WhatsApp too, but here's another example today. A
Mm.
lot of people maybe they don't know the content for this question, right? And they're like, I forget about it. What is this disease about, right? Now, which parent statement show the need for further clarification? Something you think it's an incomplete statement or wrong statement that you need to go there as a nurse and try to maybe explain something further about it, right? So the first one says, my child should start feeling better within about a week to 10 days. Good idea, bad idea. What do you guys think
Good
on
idea.
it? Good
Good
idea.
idea.
Good.
Because here they are not taking guarantee that my child will feel better definitely in 1 week, right? They are saying
Yeah.
like it's like a range between a week and this many days. My child should be start feeling better, not like 100%. They're saying, but start feeling better. So sounds like it's a good idea. It's not a bad idea. So I'm looking for a bad statement here. So this is not my right answer for sure. right? I can give my child acetaminophen if they have a joint discomfort. Now, a lot of time, in the exam, the students start thinking like, oh, can I give acetaminophen in this diagnosis or not? Or can I give the acetaminophen to a little child? They did not even give me an age in here, right? Do not overthink about it. Okay. These are just the general statements. So just ask yourself, generally, acetaminophen, is it for joint discomfort or not? Simple, right? And ask yourself,
Sounds like
is it a
man.
good idea or bad idea?
Good
Right?
idea.
Yes,
It's a
we
bad
can.
Good
idea.
idea. So I'm looking for bad statement. Let's take it out. My child is still contagious until the rash goes away completely. What do you guys think on this?
It's bad idea.
Why is it a bad idea?
Because ma'am, still contagious until the rash completely goes.
Mm-hmm.
So how we do not know about the time when will it go.
Very good. How we can be so sure that it's going to be still contagious until the very last stage? Maybe when the rashes start feeling a little bit better, maybe after 24-hour treatment or 48-hour treatment, when the patient start being on a treatment as well, the patient rashes are
Mm.
no more contagious, right? So this is like a very solid statement, right? And how we can say that this is going to be 100% happen like this in every child cases, right? So I think I need to go here and explain the parents as well that this is not maybe always the case. This always depends. I think you need to come for the follow up after this many days with your child and see the doctor. And we have to see together if it's still contagious or not, right? So this is how I will teach in that case, maybe to them, so they know a little bit more about this statement. So this is sound kind of to me where I need to go as a nurse is in there. Now, the last one says, I'll remind my child to cover their mouth and the nose when they're coughing or sneezing. Nothing bad in there, right? When someone is
Mm.
like coughing and sneezing and you're covering your mouth and nose, it's generally a good idea always in the world, right? So I'm not going to fight with this statement for sure. So the right answer for this question will be number 3.
Number three.
I hope everyone is learning here so far.
Yes, ma'am.
Yes.
Yes. Okay, you can
Yes.
always stop me in between if there is any doubt, any question. Now, this question is very damn easy. I don't want to solve this question for you because you're gonna do this question for me, everyone. Because this question, like seriously, very simple, easy question, which a lot of nurses always get in the exam. So please attempt this question for me now. I'll wait for your right answer in here. Just let me know when you're ready. Thank you. And if someone is
Ma'am,
watching
the
on the
correct
YouTube,
correct
please use
option
the
is
YouTube
three.
live chat for me. You can always drop me the answers
Correct
there as well. Yes, Sammy?
correct
The
option
correct
is
answer for
three.
this
Apply for
question is
cooling
implement
agent.
droplet precaution because this
Cooling
patient one of
canal.
temperature fever spike, and the second important thing in this the with the diagnosis of influenza, so
Uh-huh.
droplet precaution should be
Yeah.
taken for this patient.
Okay.
So the correct answer should be one.
Okay.
Yeah, ma'am. First, we need to put a droplet precaution. After that, we can apply other things.
Mm-hmm. Okay. What
Yeah, one
everyone think
is
on this?
yeah, one is good.
One is okay. Any other
One
student who want to participate here?
one is good.
One is good. Very good. Any other student, please?
First
Oh,
first
One
is
is
more,
good.
more,
ma'am.
more. Come forward, please. I really want to know who is joining today, if you're learning or not at the same time. Don't just unmute, mute and just sitting and watching it. You will not get benefit out of it, definitely, right? Try your best to participate. Even someone watching on the YouTube, please use the chat box always and put the answers in there and try to communicate as much as you can. But if you want to join next time with this kind of link with a Zoom meeting, please send me the message on the WhatsApp. I'll make you add into my WhatsApp group. So the next time you will also get the access to the link as well, right? So the right answer for this question, everyone, is number 1
One.
without wasting the time. And you can always stop me in between if there is any question in there. Now, the next question I can see is related to the room assignments, right? Now, sometimes the nurses, they're not good into this. They're like, which patient I need to put it where, with who cohorting together, right? So if you have a hard time in there, I know I already shared some notes in the WhatsApp group a while ago, but today is the chance I can teach you the content first on the screen, and then we'll go back to that question next, okay? So let's see this content pretty quickly with me, and then you apply this content content into those questions today, right? So the first thing I want to tell you related to the content, whenever you are doing the room assignments or cohorting together, right? You do have some rules to follow in that area. The first rule is who needs the private room. You really need to know who needs the private room. Always remember, airborne infection, we always give the priority first to them, to give them like the room always as a privately, no other patient in there, right? Even try your best not to put two or airborne together if possible. Always try privately for them if possible, as per the answer case. Now, the second one is severely immunocompromised. If someone is severely immunocompromised already, maybe like your patient is on chemotherapy, had a recent surgeries like transplant or those kind of procedure, definitely immunity will be low. You try your best to give them the private room if possible, right? The second thing I want to say in the rules is who can cohort with someone. So can cohort only those patients, the patients who have with the same confirmed organism together. So let's say two droplets together, and it's like let's say two meningitis patient together, two pertussis together. Like if someone has the same confirmed, definitely you can put them together if that's the option you have already, maybe in the answer case. Or maybe let's say it's the same transmission based precaution. As I said, two contact together, two droplet together, two airborne together. But I always tell my students, try your best airborne not to put two them together. But if you have no choice in the four option, you might need to put it then, right? Now the next one we have is the, give me 1 second. I got a question on my screen. Yeah, I got a question is someone is asking for the content related to this meeting. Definitely, you will get all this content, just so you know. I will put the presentation, everything into the YouTube group link as well. And I will also send you on the WhatsApp. Okay, so don't worry about the content, guys. The next topic, continue with this one, is the who can never cohort together. Never. Remember, never. Okay. If someone is immunocompromised already, you don't put them with the next infection person together. Okay. Because one person already immunity is low, another person you're bringing with a high fever or something, lot of transmission, chances definitely in there. Not a great idea. Or someone who already have the contagious infection, right? You don't put them with the non-infectious together, because one person definitely can transfer to the next person, and airborne with the other unless it's the same infection, as I said, right? Now, the last rule we have here is the stable more than unstable. So critical patients should not be exposed with the infection area or with the infection clients together, because they're already so critical. And sometimes, the critical patient, they need a quiet and calm environment too. Let's say if someone already have a seizure, so don't put them together with that patient who is already too much loud in that area, right? So that's not a good assignment together for sure. You try to find a different option in there if possible, right? So this is the basic which everybody needs to know. But now besides than this, I actually bring on the next screen in here like a small cheat sheet, which you can read it later on as well. Maybe pause this video later on, take a screenshot, keep it with you, print this note as well for your exam, because here I clearly mentioned that with the airborne, some examples in there, and they can cohort with who together. Like, for example, it says the airborne can have a private room with a negative pressure and 95 respirator mask required, and they can only cohort with the same infection only. So you don't want to put them somewhere else, right? And the droplet, it says like some conditions under the droplet, and which I already explained in my previous lectures too. But you can take a screenshot of the full list, because this is not the full list, just so you know. The full list I already put in my different class already. So you can always access the notes over there as well. But they can cohort where? Basically for them, we try our best private room always, right? And surgical mask within 3 to 6 feet, but they can cohort only with the same infection, as I said, right? And similarly, contact, some conditions comes under them as well. And you're trying to, giving them a private room if possible. And gloves and gowns definitely as a part of PPE, the nurse needs to wear, and they can cohort with the same organism as well. So this is like a cheat sheet. So you can print it and make your own notes on the top of it, wherever it's required, you want to add on something on it, right? The next one we have like neutropenic or protective related. So one who have like chemo, bone marrow transplant or severely immunocompromised. For them, we always try to give them private room first if we can. No infectious roommate for them together. Avoid fresh plants, fresh flowers in the room as well, and positive pressure room if possible for them. So this is what we try for these type of patient. Again, as I said, this is just a cheat sheet. If you like it, you can print it and make your own notes on the top of it, right? Now, moving on back to the same question, the one we want to do it today, and there might be more question right after this as well that you can solve by using maybe same principle. So here, the charge nurse, so imagine you are the charge nurses here now. So you must assign a room. I'm just going to get my laser pointer. So you must assign a room for a client who was transferred from another hospital and scheduled for the debridement for an infected wound, right? Now, which assignment is most appropriate? Maybe everything is appropriate for this patient. We don't know. But which one you think is very less infectious and better place to go together into that room? Now, try your best to find out the answer along with me. So the first one says, client with a cancer and already being treated with the steroids at the same time, do you think the person who have a schedule for an infected wound, you want to put them together with this patient? What do you guys think on it? Yes or no?
No, ma'am.
No,
Ma'am,
no.
no.
Bad idea. You don't want to put them
Bad
together.
idea.
Very good. The
Yeah, bad
second
idea.
one you have is client with the osteomyelitis. You don't know maybe what is osteomyelitis, but I think everybody know what is itis. And everybody know osteo something bone related things, right? And this
Yeah.
person is already receiving the antibiotics too, but of course the infection diagnosis is in there. If you're in doubt, maybe hold on for now and match with the next option. See which one is less infectious as compared to the other, right? So I'll keep it whole for now for majority of the students. Now the C option says the room C is the client with a GI bleed, but the vital sign is stable and is on NG tube already right now. So who is less infectious as compared to the other? So which answer you want to pick between 2 and 3? What do you guys think?
Third one.
Three,
Third one.
three, third
Ma'am,
one.
3 is
Yeah,
better.
three.
Everyone
Yes,
wants to
ma'am.
go with 3. Wonderful. Now you go between 3 and 4. The 4 is already influenza, which is your
High
droplet,
fever. Third
and
one, ma'am.
already has a high fever. So the left answer is number 3,
Third.
Three.
right? I hope everyone understand this question too as well. Very good. You can
Yes.
always stop me if there is a doubt, any question in this case as well. Now, moving on to the next question, I can see this is related to select all that apply. Okay. Now, remember all questions, whatever I'm doing on the screen, everyone, they are very, very important, just so you know. If possible, when I send the presentation, try to take a print for all the questions, okay? Because they are very frequently tested in the exam, so they might can help you a lot somewhere. Now, large-scale community disaster happened this morning, and the client must be roomed together. See, again, room assignments. According to the infection prevention guidelines, who would be appropriate? The roommates here. Just try your best along with me and only pick that answer which you know. Something you don't know, better not to play. The first one says chickenpox, varicella. You want to put them with the pertussis? Think about it. Chickenpox
no,
is who, pertussis is
No,
who,
ma'am.
right?
No.
no,
No,
ma'am.
no.
Pertussis is like a droplet or airborne?
Droplet.
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 Varicella, airborne or droplet?
Hmm.
Airborne.
Airborne.
Airborne. There you go. It's not a best assignment together. A patient requiring airborne infection isolation and another patient admitted for the heart failure. One is airborne,
No,
one is heart failure. You want to put
no,
them
no,
together?
bad idea.
No, right?
Should
No.
not do.
Now, the third one is patient undergoing the chemo placed with the patient who has a COPD and also coughing
No.
up the yellow
No.
sputum.
Bad idea, ma'am.
No,
Bad
Not a
ma'am.
idea.
good
No.
idea. You put the chemo person with infected line. Let's take it out. The fourth one is a patient diagnosed with a PID sharing a room with the patient experiencing coffee ground emesis. What do you guys think on this? You only pick the answer if you're 100% or more than 60% sounds to you as a good idea. If you're in doubt, then look at the next option first and only play with the one answer. Go to the next screen in the real
And
exam,
these
right?
these should be
The last
applied
one is
because
two
these,
patients who both have a TB. You want to keep it
Yes,
in or
Yes.
take it out?
yes.
Yes.
Nice
Because
idea.
the
Yes.
rule
We
says
will
the
keep
both
them in the
organisms can
same.
go together. Yes, very good. So fifth, you want to keep it in. Now, what do you think about the fourth option, everyone? Anyone who wants to play as the right answer, fourth option or no?
ma'am, this is similar
This
disease.
is
Like it should be picked.
stable versus unstable. I
No,
Very
no.
think.
good.
This,
You want to
these,
say something more about this one too, like similar diseases when you said?
ma'am, me, Sami,
Yeah,
because ma'am, the patient with the PAD and sharing room with a patient experiencing coffee ground emesis, these both are similar diagnoses, and these disease are on the same places, which I do not want to explore here. But these patients are with the same diagnosis,
very
probably
good.
so same diagnosis. So therefore we must take this option, and this should be applied on this patient in this
Very
scenario.
good, very good. So if you have a knowledge, then only pick this answer, everyone. Like the Sammy explained this already in there. But if you have no knowledge about it, let's see how to handle this question still, right? So the fourth one says pelvic inflammatory disease. It's like a diagnose, they name give it to you. It's not like infection, maybe right now or not, we don't know, but they give you like a diagnosis of the patient. And then they said, the second patient is experiencing coffee ground emesis. Now, when you see the word emesis, you cannot just imagine if it's a small amount, large amount, moderate amount, or what, right? Because it doesn't really say in here. But emesis is emesis. Of course, like standard precaution you want to use in here too, and also standard precaution you want to use in PID too, because you never read about them before into the list of droplet, contact, or anywhere, right? So definitely standard precaution. So let's say you do not have a knowledge, then you can think both are on standard precautions as well. And if you're sure now more than 60%, then pick up this answer this way. But if you still don't know, it's a guess idea, better not to play because you're going to lose the marks in the exam, right? But as I said, if you have a good knowledge, like the Sammy explained me this one too, and I think Yusuf was also trying to saying about this one earlier, the same thing as well. Sorry, Yusuf, I cut you off in between, but I'll give you opportunity into my next question as well. But yeah, if you have a good knowledge like this, then pick up this answer for sure. Number 4 and 5 is the final answer for this question. But if someone has a doubted, better not to play, right? Then only pick number 5 for yourself. Now, moving on to the number 7 in this case, the question says the nurse is the prioritizing the room assignments. Oh, again, room assignments in the emergency department. Now, which client should be placed in a private room first to prevent the spread of infection, right? So who wants to go to private room first? First. So you always know that we have to think about airborne is on the top of the list, and then you have the droplet, and then you have to give the opportunity to the contact after, right? So try your best to find out the answer. You're going to do this question for me and tell me the right answer is which one do you think and why? And students who are watching on the YouTube, please type the answers into chat box. I'm watching your answers as well in
Well,
there. I can see Rich Khan
should
and
I try
Mandeep
to
was there.
should I
Yes,
try
sorry,
to answer?
Sammy?
I
Yeah,
think
yeah,
it should be number 4. Okay, sorry.
yeah.
The four
Anyone?
is correct answer.
Mm.
The four is correct answer if I rationalize, because this patient is suspected. He is not confirmed. And if we look into the other options, a client such as in like option one, a client with chicken pox for more than 2 weeks. This patient is already
Yeah,
diagnosed two weeks ago.
Yes.
very good.
And the
And
second,
this is
if we
already taking antibiotics since 2 days.
yeah,
Antibiotics.
and the second one,
Yeah.
he has been taking antibiotic from 2 days. If we look into the option three, a client with a
3.
rash and itching on the leg after contact with, he has
Voice
contact
and
with a poisonous
yeah.
person, is a poisonous such as in other thing. But the option four,
Fourth one.
client with suspecting whooping cough, it could be pertussis, experiencing severe cough episodes. It should be tuberculosis. It should be anything. It should be influenza. It should be COVID. We do not know.
Very good.
So
Correct.
Very good. Very good. So I can see some of the other students, they also answered the number 4 as well. Very good. If anyone has a different answer here, let me know so I can also explain it for you. But the right answer is number 4 for this question as well. Very good. Let's see the next question in here with me. The nurse is teaching the adult child of a client with Alzheimer's disease about the home safety. Now, which of the following statement made by the adult child show the correct understanding of the teaching? And this is the last question for today, because we are almost close to the end of the time today. The rest session, I'll bring it tomorrow. Please try your best to answer this question and let me know when you're ready with the question along with me as well, right? And I'll do this question for some students too who don't know still how to solve this question as well, okay? The first one says, I will install grab bars in the bathroom, near the toilet, and inside the shower. So what was my keyword here? The keyword before the last line I can see Alzheimer's disease, about home safety, right? So do you think for these patients, is it a good idea to install the grab bars in the bathroom, and especially near the toilets and inside the shower? Good idea, bad idea? Everyone?
Good
Good
idea.
idea.
Good idea. Let's keep it in. I should keep the lights dim around the house to help encourage the rest. You want to dim the lights, or do you think the good lighting
No, ma'am,
supposed to be
it's a
there?
bad idea.
Bad
It's
idea.
Bad
Good
idea.
idea.
Very good, everyone. Now let's go to third option. I can organize my parents' medication in the pill box so it's easier for them to take on their own. Good idea, bad idea?
Good
It's a
idea.
good. It's a
Okay,
good
Great
who
idea.
idea.
Bad
said bad
idea.
idea now? I want that person
Great
to come
idea.
forward, please. Yes?
It's maybe it's a
Oh,
bad
Yes,
idea
yes, yes. It
because
is a
it's
bad
a
idea for
Alzheimer
sure.
is
I want your rational, please, for the other students.
because it's a Alzheimer disease. The
Ma'am,
Very
patient
because
good,
will
it's
very
not
Alzheimer
good. Because
memorize.
disease.
it's Alzheimer's
yeah.
disease, they can't take it by themselves, right? You really want to
Yeah.
put this medicine box, the pill box, in a locked cabinet, right? And give this
Who
medication
answered
when they
that?
need it, right? So
Who
even
answered
it
that?
sounds good to you, but read the check the rational. You see the keyword here, Alzheimer's. I'm not going to do this for this client in there. So this one, I don't want to keep it in. Bad idea. I will have my parents wear an identification bracelet, like something with the name, ID, something allergic reaction, those kind of ID bracelets. They'll help return them home if they wander. Good idea?
Good
Bad
idea,
idea?
ma'am.
Good
Good
idea.
idea.
Okay,
Good
good
idea.
idea. Why good idea,
Good idea.
Rajan? You
Because
said
of
good
they
idea?
can because of its
It's
Alzheimer
identification
disease, they
purpose.
can't remember anything.
There you go. And they
Yeah.
can go
It's
outside the house too sometimes,
Yeah.
right? They can left the place too. So this is very common, could be happen as well. So definitely it's a good idea. Let's keep it in, right? Now the number 5 is, I will remove the throw rugs and extra clutter from the floor to reduce the fall risk. Good idea, bad idea?
Good
tremendous
idea.
idea.
Good
Good
idea.
idea.
I'm pretty sure everyone loves to do the select all that apply question now for sure.
Yes, ma'am.
Like using good
Yes,
idea,
Yes.
ma'am.
bad idea, because it's working. Because I can see now it's working with all of you. So I'm happy to see that as well. So the right answer for this question is 1, 4, and 5 for this one, for this question. Now we have a shortage of timing today and tomorrow as well, but I'm trying my best to bringing the sessions separately as much as I can. So tomorrow, more question practice on this topic, along with the discussion of the content with the same question, what I'm going to bring tomorrow as well. But it's the same topic in safety and infection control. So everyone, whoever watching this video now, even on the YouTube or anywhere, please watch the part 2 after this video. And if you cannot find, send me a message on the WhatsApp. I always drop my number or the WhatsApp in the YouTube videos as well. So you can always send a message to me so I can send you the link as well. And that's all about the session for today, everyone. Now, I hope everyone liked the class for today. Any last minute question for me before I go today?
Ma'am,
Thank
with
you
you
so much,
everything
ma'am.
is good.
Everything is good?
Yeah.
Okay, everyone is good so far? We can leave now?
Thank you so much, ma'am. You are very nice.
Yeah, no
Lots of
worries,
respect,
no
ma'am.
worries.
Thank you
Well, thanks
so
for
much.
joining today. I'll see you guys back again as well in the WhatsApp groups as well. Thank you so
Thank
much.
you.
Thank,
Have a great day.
thank you so
Bye-bye.
much, ma'am.
Ma'am,
No
Thank
Thank
worries.
you.
Take
you
care.
so much.
Bye-bye.
Thank you.
This is my first
Bye
Bye.
bye.
class.